This video is created by Professor Fareya Usmani, breast laparoscopic and general surgeon working in Karachi, Pakistan. Have you ever wondered what the treatment options for primary breast cancer are? As we venture into this important discussion, we'll touch upon an array of treatments that are paving the way for progress in the medical world. From surgical interventions like lumpectomy and mastectomy, to non-surgical treatments such as radiotherapy, chemotherapy, hormone therapy, targeted therapy, and even bisphosphonates. Each has a unique role in managing breast cancer. In this video, we will explore these treatment options in detail. So, are you ready to take this enlightening journey with us? First, we will discuss the surgical options for primary breast cancer. There are several types of surgery that may be considered, depending on the specific circumstances of each patient's case. One option is a lumpectomy, also known as breast-conserving surgery, where only the tumor and some surrounding tissue are removed, preserving most of the breast. It's often recommended when the cancer is detected early and is confined to a single area of the breast. Then we have the mastectomy, which involves removing the whole breast. This might be recommended if the cancer is larger or has spread throughout the breast. Finally, there's breast reconstruction. This surgery can be done at the same time as a mastectomy or later on. It uses implants or tissue from other parts of your body to recreate a natural-looking breast. These surgical options aim to eliminate the cancer while striving to preserve or restore the breast's appearance as much as possible. Surgery can be a very effective treatment for breast cancer, but it's not the only option available. Now, let's move on to the non-surgical treatments for primary breast cancer. The first non-surgical treatment we'll discuss is radiotherapy. This therapy involves the use of high-energy X-rays, carefully measured and controlled, to destroy cancer cells. Typically, radiotherapy is used after surgery to kill any remaining cancer cells, but it can also be used before surgery to shrink large tumors. Next, we have chemotherapy. This treatment uses anti-cancer drugs to destroy cancer cells. It can be given before surgery to shrink tumors, after surgery to kill remaining cancer cells, or as a standalone treatment for advanced cancer. Chemotherapy is typically administered in cycles, giving the body time to recover between treatments. Then there's hormone therapy. This treatment works by blocking hormones that certain types of breast cancer need to grow. It's often used for long-term management of hormone receptor-positive breast cancer, which is the most common type of the disease. Another non-surgical treatment is targeted therapy. This involves drugs that specifically target cancer cells, blocking their growth and spread. These medications are often used when the cancer has specific genetic changes that make it more likely to respond to these treatments. Lastly, we have bisphosphonates. These drugs can help reduce the risk of breast cancer spreading to the bones and other parts of the body. They work by slowing down or altering the activity of bone cells, making it harder for cancer cells to survive and grow in the bone. Each of these treatments offers unique benefits and can be used at different stages of the disease. It's important to note that the choice of treatment is highly individualized, based on factors such as the type and stage of cancer, the patient's overall health and personal preferences. Remember, these non-surgical treatments can be used alone or in combination with surgery to treat primary breast cancer. They offer hope and options for those facing this disease, bringing us ever closer to a future where breast cancer is no longer a life-threatening condition. These non-surgical treatments can be used alone or in combination with surgery to treat primary breast cancer. Let's summarize what we've learned about the treatment options for primary breast cancer. Starting with surgery, options include a lumpectomy, which removes the cancerous tumor and a small margin of surrounding tissue, and a mastectomy, where the entire breast is removed. Each surgical approach has its own benefits and potential drawbacks, and it's essential to discuss these with your healthcare team. Next, we have radiotherapy, a treatment that utilizes high-energy X-rays to kill cancer cells. This method is often used after surgery to ensure any remaining cancer cells are destroyed. Chemotherapy is another option. It uses powerful drugs to kill cancer cells throughout the body and can be used before or after surgery, depending on your specific case. Hormone therapy, on the other hand, works by blocking or reducing the amount of hormones in the body to stop or slow down the growth of cancer. We also have targeted therapy, which are drugs designed to block the growth and spread of cancer cells specifically. Finally, bisphosphonates can also be used to reduce the risk of breast cancer spreading to the bones and other parts of the body. Each of these treatments has potential side effects and may affect individuals differently. It's important to weigh these considerations against the benefits of each treatment option. Remember, the best treatment plan for you will depend on your individual circumstances. Always consult with your healthcare team to determine the most appropriate treatment for you. You can contact. If you have been diagnosed with primary breast cancer, your treatment team will discuss your treatment options with you and their possible side effects. These pages can help support you with more information about your treatment options. Healthcare information surgery for primary breast cancer. Find out about the different types of surgery for breast cancer, including lumpectomy, mastectomy, and breast reconstruction. Healthcare information radiotherapy for primary breast cancer. Radiotherapy uses carefully measured and controlled high-energy X-rays. Learn more here. Drug chemotherapy. Read our chemotherapy guide for breast cancer. Learn what chemotherapy is and when it's given. Drug hormone, endocrine therapy. Find out what hormone therapy is, when it's given, and the possible side effects. Drug targeted, biological therapy. Targeted therapy is the name given to a group of drugs that block the growth and spread of cancer. Learn more here. Drug bisphosphonates for primary breast cancer. Bisphosphonates can be used to reduce the risk of breast cancer spreading. Find out more. You can contact Professor Fareya Usmani at 00923219294138 or visit her at OMI Hospital or BHO Clinic, Karachi, Pakistan. Please like, subscribe and comment on our video. Thank you.